Welcome. I am Ed Nykaza from Glooko. Today's presentation is on how remote care is driving the future of digital health to improve health outcomes. During my presentation, I encourage you to put any questions or comments in the chat. And we'll also be using the poll feature to get some feedback on specific questions. Thanks for joining me today. Here are my disclosures. I'll show you some of the ways diabetes care and education specialists like yourself are currently using Glooko for RPM. I'll then show some of the latest results, which includes a randomized clinical trial and real-world evidence. And then I'll end the talk with planting the seed of where we are going and how we plan to take our remote patient monitoring to the next level and how you can be a part of the solution. But first, let's start with why I'm here. The story starts back in 2009. It was a warm spring day in Washington, D.C., and the cherry blossoms were in bloom. I remember how bright and warm the sun felt when I emerged from the dark and cold boardroom, where I just survived an intense interrogation from the Scientific Advisory Board. It was a good day, the best day. In fact, the pinnacle of my research career at the time. The Scientific Advisory Board just approved a large 5-year research study that I would be leading. I was on cloud 9. As I descended into the metro, my phone rang. It was my wife, Kelly, and I assumed that she was calling to hear how the presentation went. But when I answered the phone, I knew immediately she wasn't calling about the presentation. In a matter of seconds, I fell from cloud 9 in the best day of my life to one of the darkest and worst. My wife was calling to let me know that my 5-year-old daughter, Leah, was just diagnosed with type 1 diabetes. The years that followed my daughter's diagnosis were tough on my family. They were filled with sleepless nights, so many alarms, and way too many finger pricks and juice boxes. Over time, we learned a few things. Technology improved. We started sleeping through the night again. And I'm happy to report that Leah is a happy and healthy 17-year-old. So the reason why I'm here today is because my daughter was diagnosed with type 1 diabetes about 12 years ago. I'm a PhD researcher, a practicing data scientist, and the dad of Leah, who lives with type 1. I'm here because I want to make a difference in the lives of those living with chronic conditions, and I want to collaborate with people that are as equally as passionate. Thought before we get into remote patient monitoring, I would share some of Leah's data. This graph shows a yearly rolling average of the percent time in range. Each data point represents a year's worth of CGM data, and the entire figure encapsulates around 400,000 CGM data points over a 4-year time period. As you can see, Leah's time in range has significantly increased over the past 6 years. But the point of showing the graph is not to endorse some of the do-it-yourself movements. Rather, I want to share how the graph evolved and suggest that this paradigm could be the way forward. This graph is the direct result of me, a data scientist, working directly with some amazing diabetes experts. This graph is now the first thing we look at during my daughter's quarterly doctor's visit. We first look at the big picture trends to see we are heading in the right direction before diving into the recent details. This brings me to a few questions. How many of you routinely look at this type of trend to know whether your patients are heading in the right direction? What type of insights and graphs are useful to you? If you have ideas, please do not hesitate to reach out. I think the key to driving innovation is collaboration between technology, data science, and diabetes experts like yourself. Let's talk about remote patient monitoring and how this could be the future of digital health. I'll show you some of the ways diabetes care and education specialists are currently using Glooko for RPM. And I'll show you some of our latest study results, which include a randomized clinical trial and real-world evidence. Working together is more important than ever, given our current chronic disease management crisis and the shortage of diabetes experts. As technology continues to advance, we will have even more data at our fingertips that we need to make sense of. The industry has come a long way due to the pandemic in terms of RPM. COVID-19 has fueled unprecedented demand for virtual care, and the rise of the geriatric population is leading to greater need for remote care. And despite this general awareness of the problem and need for remote care, there is a gap in the utilization of remote care. For example, one of our recent healthcare provider surveys found that more than 70% of HCPs are not aware of the CPT billing codes that can be used for reimbursement of remote care. All right, I'll get off my soapbox. But if you are in that 70% that are unaware or not billing, I implore you to educate yourself about the reimbursement opportunities with remote patient monitoring. At Glooko, we enable remote care through our population health tool. This tool allows you to define and view at-risk patients. Our population health tool makes it easy for you to enroll patients in an RPM program and facilitates getting reimbursement for RPM by providing you with the data report that is required to support the CPT billing codes. You are also given the tools to define at-risk populations by demographics, device, and beyond A1C metrics such as percent time in range, time in hypoglycemia, and time in hyperglycemia. Out of the box, we provide predefined standard definitions of at-risk that you can leverage, or you can create your own. The figure on the right is showing you the population health view. Here you can see the various flags that have been associated with patients on the list, which you can filter based on specific at-risk flags. The last aspect of our current remote patient monitoring tool is our pre and post intervention tool. This tool allows you to see various glycemic outcomes before and after the intervention, so you can get a sense of whether the intervention is effective. Our remote monitoring tools are effective. Here you can see the data from a randomized clinical trial that looked at those using Glooko's RPM tools and those in the control group, which was the standard of care. And if we filter the data to those that are considered high risk, those with a baseline of an A1C greater than 8.5, we find an even bigger drop in A1C, a drop of 1.2 percentage points and 1.5 percentage points at 3 and 6 months after the RPM program. As you can see, the drop is much bigger than those in the control arm, which was, again, the standard of care. We also have some real-world evidence that supports our RPM program. This data is from a pilot program that was run across 11 different clinics and was recently presented at ADA. Here you can see the mean drop is close to 20 mg/dL over the 3, 6, and 12 months of being on RPM. And when we look at the percent time in range across those same time periods, we find a sustained increase in the percent time of range, and it levels off around about 75%. For the last part of my talk, I'd like to give you a sense of where Glooko is heading and how you can help. We believe the future of digital health tools not only includes remote care, but also includes setting SMART goals and making sure these goals are a collaboration between the patient and provider. By SMART goals, we are specifically talking about specific, measurable, achievable, relevant, and time-bound goals. SMART goals can include things such as increasing the number of times you check your blood glucose per day, to reducing the number of missed meal boluses, to increasing steps or decreasing calories. As we design these tools, we realize there are obstacles. Some patients don't understand their condition. Providers don't often have enough time during an appointment. There are social barriers to making changes to routines and habits. And some people are just unwilling to change. Again, this is where you come in. We are working on the infrastructure and the system to make it easy to implement SMART goals. But it will be up to you, the diabetes experts, to work with your patients to actually set the SMART goals. In this example, we highlight increasing daily steps from 5,000 to 10,000 steps per day might be a little bit too ambitious. Whereas setting a goal of 6,000 steps per day is more realistic and achievable. Lastly, we are working on making it easy for you and your patients to track the goals you set together, so you can tell whether your patients are heading in the right direction. Our vision and future includes you. As we continue to develop and enhance our remote care and SMART Goal program, I encourage you to reach out if you have ideas on how we can innovate together. Thank you.